Thanks for staying here with Daybreak. In clinical practice of neurosurgery, headache is one of the most common symptoms. Today, we'll introduce several diseases which causes headache and are treated by neurosurgeons. Joining me right now is Dr. James. Good morning and welcome.
Good morning, Sheena. Good to see you again.
Good to see you again. Great to have you back on the island. You are a visiting consultant that comes down every 2 months and meet with patients. But what sort of headaches should a person actually see you for?
I'm prepared to see all types of headaches. What I would say is that most headaches are innocent. Most headaches are not sinister. The common cause of headaches are patients who have a lot of stress, a lot of neck pain. Headaches associated with neck pain and migraine are very common. But I think the headaches that one should look out for are headaches, for instance, that are worse in the morning, that get better during the day. Patients who find that when they've got a severe headache, lying down actually makes it worse rather than make it better.
Wow.
That's an indication that this is just more than just a simple headache. One mustn't also forget that a lot of people wear glasses.
Right.
And headaches can be associated with, double vision. It's important that if you do wear glasses, to have your glasses checked, have your vision checked, just to make sure it's not an eye problem. If you find that you're going to the opticians and you find that your glasses are being changed quite regularly, then that may indicate that there's something else going on rather than having an eye problem. Certainly patients who have found that coughing or sneezing or there's persistent vomiting, these are headaches that should be looked at pretty soon, pretty urgently.
Are these the signs you would say that people don't really pay attention to and is the reason why they become ill?
Yeah, or it is doing that because they've had headaches in the past,
right.
That this is just a normal headache. What is not a normal headache, if you have things like change in personality, or people can begin to forget things, or people find that they have to start writing things down, or the patients who keep on forgetting names, which is unusual for them. And of course, these are also normal things that you get as one, matures with age. But what's, certainly if you have headaches and you start getting weakness, for instance, or you find that you can't write, or you find that you black out. These are things that need to be seen fairly urgently.
Those are the major headaches.
Yeah.
Now, how does one know that they don't have brain tumor, that these signs aren't leading up to that's exactly what they have? How do they determine that?
That's quite difficult because even as a neurosurgeon, I see it, and it's quite easy for me. And what I say to patients and to other physicians are, firstly, if the headache is persistent, when I mean persistent, it doesn't go away. As I say, it wakes patients up at night. Now, what I mean by that is not people who wake up and they have a headache, but they wake up because of the headache. And things, headaches that are always there. Now, if you think of migraine and tension headaches, and if you had a stressful day at work, it gets worse, obviously. But as the day goes on, it gets better. But it's the patients who have headaches all the time, that's quite severe. Or they have a sudden burst of headache, and that's common when you have a hemorrhage in the brain, where you have a burst blood vessel. And that's very different because 1 minute they have a headache or they don't, and the next minute it's like an explosion going inside the head. And people will explain that I was all right in 1 minute and then there's like an explosion go off in my head.
Now, with all these signs that you're telling us, what should one do? Who should they see?
I think the first protocol for anybody should be the general practitioner, or the internist, or you can come straight to a neurosurgeon like myself. I think we are duty-bound, as all physicians and surgeons, to at least get a scan. That could be either a CT scan or an MR scan. I prefer the MR scan because it's more in-depth, and it tends to not miss things. And sometimes, that is all the patient needs. Because a lot of people think that, is this a brain tumor?
Sometimes it's just a simple scan.
Absolutely.
Now, I know, as I mentioned earlier, you're visiting here now. You're leaving soon, but you are coming back every other month. How do people get in contact with you?
Yeah. Well, a slight correction on that, Sheena, in that we will be here, when I say we, myself and my colleague, will be here on alternate months. So we're here
Okay, so
every
it's a
month.
tag team.
Yeah, it's a once a week every month. I actually am going to be here every month between now and July,
Okay.
and in July I'll be here for 3 weeks rather than 1 week.
Okay.
And the best way is to ring Chrissy Thompson
Chrissy
Hospital,
Thompson.
yeah,
Okay.
or contact the Georgetown Hospital because they know when
When you're
here.
in town.
Yeah.
Okay. All right. Thank you so much for
That's
coming
very
in this
kind.
morning and educating us and telling us about these signs and symptoms that we sometimes just take for granted and we really should be paying attention to. So I appreciate that. And of course, a reminder, if you do have headaches and need to see a neurosurgeon, you can certainly call the Chrissy Thompson or the Georgetown Hospital, and they will sort you out with Dr. James and the other visiting doctor. Thank you. We're going to take a break. We'll be right back with Did You Know and Vigor Nursery Mother's Day gift ideas, so stay with us.